So the first step in the correction is to mark the bifrontal craniotomy, where along with the neurosurgeon we raise the bifrontal craniotomy. Now if you look carefully, this orbit is about half a centimeter lower than its counterpart. So we will design the osteotomies in such a way that will level the cuts. So we need to resect about half a centimeter of bone here, our next step is to mark the midline. Now let's move on to the orbital osteotomies. So along with the supraorbital osteotomies, we will mark out the lateral osteotomies, zygoma, the lateral osteotomy will come at the level of the inferior orbital fissure and then through the base or the floor of the orbit, and then connected behind the lacrimal apparatus into the nasal bone, and then connecting the supraorbit, the orbital roof osteotomies. This is the orbital osteotomy on one side. Similarly, we'll mark the osteotomies on the other side, behind here, behind the lacrimal apparatus, and connecting the roof. So now we have marked the orbital osteotomies. Before we move on to the amount of resection, let's mark the inferior limit. So here we have the infraorbital foramen, and just below that we can make our inferior osteotomies of the box, which is here. After we mark the box osteotomies, now we need to decide how much to resect in the nasal bone. Currently her interorbital distance is about 3 centimeters, and normally we need to make it around 2. So we've calculated based on preoperative clinical measurements to take about 7.5 millimeters on either side. So this much is the amount of bone that needs to be dissected. So in summary, we have marked the bifrontal craniotomy, we have marked the orbital asymmetry height difference of 0.5 centimeters, we have marked the nasal resection and ethmoid resection of 1.5 centimeters, that is 7.5 and 7.5, and then I have marked the box osteotomies, that is orbital or supraorbital roof, lateral orbit, orbital floor, medial orbit. We've marked the lateral orbital wall osteotomy, the zygoma, and the floor of the orbital box. This is the planning for the surgery, and our next step now is to follow these cuts and make the movement.